Am I right? The aim of this experiment is preparation and fixation of the sputum smears for cytological study. Let's know about this experiment. A cytological examination of sputum is a microscopic procedure which can determine the presence of cells that are not normally present in it. What we need to understand is here the sputum can be taken as a sample, and this sputum sample uh, we can do this in microscopic study of this sputum sample, where we can be able to determine the presence of cells which are normally not present in it. Okay, so we can do cytological test as well. Okay, and what we require is we require glass slide, spreader, cotton, some inoculating glove or some stick or some curator like a spoon like curate. So these are the what we the equipments we can need to provide. Sometimes we also require centrifuge machine which can help to centrifuge and get a pellet or sediment. Okay, and sometimes we require reagent as a fixative as a reagent. Okay, so first of all, let's know that we require some instruction. We need to know some instruction that how to collect his sputum sample from the patient. The best time for sample collection is it's suggested that the early morning before eating or drinking anything is the best time for sample collection of sputum. Okay. Next, what to avoid? So do not eat. So do not drink, do not smoke, do not brush your teeth, or do not use any mouthwash before collecting your sputum. Are you getting? Are you able to understand?
Yes, sir.
Yes, one of you can give me the feedback. Okay. So these are the collection instruction that best time for sample collection, what we need to avoid during the sample collection. And the next thing is that we need to remember that make sure your first name, last name, and date of birth are on level for the sample bottles. Okay, so it's a label on the it's a labeling what we need to understand that there may be the more than one sample, there may be the mixing of the sample. To avoid that, we need to label the sample properly with the patient name, patient first name, patient last name, then patient date of birth. So this is very specific identification criteria for the patient, and we can label it on the bottle of the or container of the sputum. And this is very important instruction. We should remember this. We do not forget to label this. Next, suitable area for a sputum collection. What is the suitable area? Where where should we collect the sputum? So the most preferred area is for sputum collection is that we need to collect the sputum away from other people. So we need to be away from other people because when you cough to take out the sputum, at that time, some if there is an infection, then the pathogen may come out and it can be inhaled by other people. So it's the good area is we need to collect a sputum uh, at the area which should be away from the people who are uh, available in the office or somewhere else. So if possible, go outside or open a window and you can just take the sample. Okay, so either you can collect the sample outside your uh, your office area or your we can say home areas, or you can collect the sample near the window so that anything you cough it out, it goes out of the window. Okay, so this is a suitable area to collect the sputum sample. Precaution, what precaution we need to understand that do not touch inside the sample bottle or inside the cap. So this is the precaution because it may can contaminate the sample, right? So this is the instruction that the patient should not touch is from the inside of the bottle or should not touch the inside of the cap. This we need to remember. I hope you are understanding. Sputum collection procedure. What are the procedure now? Let's know the step-by-step procedure to how to collect the sputum. Take a deep breath. So when you take a deep breath, what happens? After that, we need to hold the air for a few seconds. Just take the breath, deep breath, and hold the air for a few seconds and breathe out slowly. You need to breathe out slowly and take another deep breath and then do cough hard until sputum comes off in your mouth. So we need to do the coughing, very hard coughing, so that the sputum will come out in your mouth and then spit the sputum into the sample bottle. So we need to throw out the sputum in the sample bottle and do this until there is enough sputum to cover the bottle of the bottom of the bottle. So we need to ensure that you have collected sputum which is enough sputum. Okay, appropriate amount of sputum has been collected. So we need to do otherwise we need to repeat the process once again. Okay, so this is the basic criteria to collect the sputum from the patient or from yourself. After that, once the sample is sufficient or enough sputum is collected in a container, so the next step is that you need to screw cap the bottle on the sample bottle tightly so it doesn't leak. So the screw cap should be capped. It should be tightly closed. The lid of the bottle container should be closed tightly. The cap should be closed tightly in order to avoid any leakage from the home container. Okay, and the next point is you need to write the date and time of collection also. Okay, so the bottle should be written with all the information, including the name, first name, last name, date of birth of the patient, and even the date and time of the collection of the sample. Right, seal the sample bottle in the plastic bag it came with. So the plastic bag is available with a container, so we need to put it in the same plastic bag and we need to seal it out. Okay, uh, do not put more than one sample bottle in each plastic bag. So if there is a two sample, so do not put all the two sample in a same plastic bag because the two bottle may be from the different patient. Okay, and make sure the test requisition form is put in the pouch on the outside of the plastic bag. So if there is a pouch over there, or you just ensure that requisition form is attached with the the sample. Right, this is what we need to understand. Requisition paper is very important. If there is no requisition paper along with the sample, then it may can cause miscommunication or misconfusion, and this leads to changing or mixing of the sample. So I hope you have understood. After you finish collecting your sputum, wash your hands, and finally we can go for the sample storage if required. Now till now, if you have any question, please let me know. Sorry for late one. Please, Nando. Okay. Is there any question till now? No? Hello? Are you listening? Okay.
Yes, sir.
Coming to the next slide. How can you store the sample? Sample can be stored at a low temperature. So if you are unable to deliver a sample immediately, you can keep it for some time in the refrigerator. So this is what we can store the sample at the refrigerator temperature. Do not store at room temperature or in a freezer. So this is what precautions should be taken, because at room temperature there may be the growth of the microorganism, or if you put in the freezer there may be the cell damage, where the cell is present in the container or the sputum, the cell may can be lysed or damaged. To avoid, so we should avoid putting in the freezer, or we should avoid storing at the room temperature. Now if we have collected the sample, now we need to know that some fixatives which are very essential, very important, and what fixatives we need to know, which is required for the sputum sample. So we can take the 70% ethanol or we can take very very specific fixative which is recommended for the sputum sample. It is a Saccharomyces fixative. Saccharomyces fixative is the first used by Saccomono for pre-fixation of the sputum, and the composition of this Saccharomyces fixative is that we can take 50% alcohol and approximately 2% of carbox. And to prepare this 50% alcohol and 2% carbox, we can take 434 ml of water, 526 ml of 95% ethyl alcohol, and 40 ml of water. So this gives the concentration of 50% alcohol and 2% carbox. Now, if you then after that, how can do the fixation with this fixative? So Saccharomyces fixative can be taken, and then we can let the patient expectorate directly into the cups containing 50 ml of preservative, and we need to shake well. Means and you need to take this Saccharomyces fixative in a container, approximately 50 ml, and after that we have to give the container with the fixative to the patient, so that the patient can expectorate, means you can the cough and throughout the sputum directly into the cups. And then after that we need to the patient should, or we need to shake well so that the fixative and the sputum can mix well. So here never use absolute alcohol. Here we need to take the only 70% alcohol or 50% alcohol. Okay. What happens if we take absolute alcohol as a fixative? It contain dehydrating agent or dehydrating property, and so that it can cause the mucus to become hard and rubbery and difficult to blend. So we cannot blend it out. We cannot because of the mucus change its property from soft or mucoid viscous to the hard and rubbery, and because of that we cannot blend it out on the glass side. Now, what processing instructions are there? How can we process the specimen now? The preservation of cellular morphology until the sample can be processed is essential to accurate cytological interpretation. So this is very very important, that the preservation of cellular morphology is very very important. We need to preserve the morphology of the cells, and this is until the sample can be processed is this is the essential part of the cytological process. So, for the preservation purpose, prefixation refers to the collection of fluid specimen in a medium that will preserve morphology up to the time of slide preparation. What does it mean? That we can do the prefixation where we can collect the specimen directly into the on the container having the fixative, which can preserve the morphology of the cells, right? So this is the processing of fluid specimens. Uh, with trace specimen may be submitted to the laboratory without preservative. The trace specimen we are talking about, it can be directly submitted to the laboratory, and in such cases, flash facilities immediate. Uh, in such case, what happens, the facilities for immediate processing should be available. So in such cases, what happens when there is a fresh specimen submitted to the laboratory, so the facilities in the library should be there, that they should process the fresh specimen as soon as possible. There should be some facilities over there. The greater length of time between collection and preparation of sample leads to cellular damage. So if there is a prolonged gap between the collection and processing, so it may lead to the damage to the cells. And the extent of damage depends on the change in pH, protein content, enzymatic activity, and the presence or absence of bacteria. So because of this adverse environmental, like the pH, the protein content in the sample, the enzymatic activity in the sample, and the bacteria, these all can be the factors which may can damage the cells present in the sample. And it is not possible to predict these variables even in the specimen from the same anatomic site. However, the following guidelines will usually yield acceptable results. So we need to be careful that the specimen should be fixed into a fixative, and the morphology should be maintained, and we need to take care of this, very very important, because cytological examination requires that the cells should not be damaged. Sputum contain high amount of high mucus content. as we know, the sputum sample has a mucus content in high amount, and because and may be preserved for 12 to 12 hours if refrigerated. So we need to we can preserve the sputum for 12 to 24 hours. Okay. And if refrigeration slow the bacteria growth that causes cellular damage and the breakdown of mucus. So if there is a high content of mucus, okay, so this mucus is good for the cellular part of the sputum. The cells damage can be slowed down, because the bacterial growth that causes cellular damage and the breakdown of mucosa can be slowed down during the refrigeration process. Mucus apparently coat the cells and protecting them against rapid degeneration. And the cells in specimen without the thick mucus or with saliva are not well protected. So if there is a no mucus in the sputum, then and if there is a saliva in the sputum, so it may can deteriorate the cells. It may can damage the cells. So it is good that the mucus should be there in the sputum, and with the mucus we can store the sputum for 12 to 24 hours. But if there is no mucus in the sputum, it means the cells may can be damaged very early. Processing of the sputum here, mucoid samples present unique challenges. So concentration of cells by centrifugation is not possible because of high viscosity. So we cannot concentrate the cells in the sputum by centrifugation process, because it has a high viscosity. The sputum is highly viscous, and to increase the diagnostic yield, we can go for the different methods to process the sputum. We can prepare peak and smear technique. We can go for the Saccharomano's technique, or we can go for a variety of chemical homogenizing procedures such as dye, thiazide, mucus liquefaction have been developed. So these are the different methods have been done to process the sputum sample. Okay. And let's know about peak and first let's know about dithiothiazole mucus liquefaction method. Here DDT, that is known as dithiothiazole, which we can take 0.2% in 60% ethanol and 3% carbox. So this solution, DDT solution, this is the composition of DDT solution. So when you take the DDT solution, now if the sample is fresh, we can add twice the volume of DDT solution. For example, you have taken 5 cc of sputum, so we can take 10 cc of DDT. Okay, so we can take twice the volume of DDT solution to a sputum sample. Now thoroughly agitate sample with vortex mixer. Okay, so we can agitate the sample, and we can take the we can mix into the vortex, and we can let this stand at room temperature for 30 to 60 minutes, and we can periodically we can also vertex this out. So centrifuge sample, prepare slides by the method of your choice. Allow slides to dry and then stain. This is the one of the way we can process the sputum sample in the lab. Okay, when we collect the sample, just we can take the DDT solution, and we can mix the DDT solution in twice the 1:2 ratio, and after that we can mix it on the vertex. We can allow to stand it for 30 to 60 minutes, and after that we can centrifuge. We can prepare slides uh, by the smear method, and we can do the air dry. We can do the staining process. Another method is a peak and smear technique of sputum processing, where this is the curate type spoon, or you can take in a gluting loop, or you can take a stick. And what we can do with it, we can take this technique is applicable to fresh sample or sample prefixed in 50% alcohol. So this method is applicable to fresh sample or the sample which is prefixed in alcohol. Now we can select any bloody or any discolored or any solid particles of sputum using small curate type spoon or sticks. So with the help of this stick, we can take the some solid particles of the sputum. Either it can be blood type or it can be the discolored type. And now the transfer the sputum not larger than the size of this pea. So that the amount should be at the size of the small pea. it should be transferred to a slide. Gently crush the bottom between two slides. We'll take another slide and we'll crush it, and we can distribute the material thinly, evenly over the surface of the slide. So this is what we can make a smear by crushing between the slides and distributing between the these two slides, so that it can spread thinly and evenly over the surface of the slide. So we can fix again immediately, and now we can go for the staining process. Now, what are the indications for cytological examination of sputum? So here, lung cancer is one of the condition where you can do the sputum examination, and there are non-cancerous lung conditions such as pneumonia, inflammatory disease, tuberculosis, and asbestosis. So this in this condition where we go for the examination of the sputum for cytological purpose. Now, limitation for this test is like this test is not used as a method for early detection of lung cancer. Okay, so early detection or screening of lung cancer is not possible with the sputum examination, but by through the sputum examination we can be able to examine if there is a lung cancer, or if there is a pneumonia, inflammatory disease, tuberculosis, or asbestosis related to the lungs. Then we can be able to diagnose it. So we have come to the end of the slide, and now if there any question you can ask. We have completed the lecture. You can ask the question now.